Doctor, how are you?
I'm good, thank you. How are you?
I'm fine. Thank you for asking, sir. So I have a couple of questions regarding coronavirus, if you don't mind me asking.
Yeah, sure.
Thank you so much. So could you please, first of all, briefly introduce yourself?
Yeah, myself, Dr. Zahid. I'm basically just came back from Australia recently, about 2 years back, and I'm the member of Australian Medical Council, and as well as Pakistan Medical and Dental Council as well. And just started about 2 years back here, my this this hospital, and anything else if you want to know?
Yes, that's great. Interesting. Sir, what kind of work are you able to do in your hospital related to coronavirus?
Yeah, you can say this SOPs, the main thing. Actually, not only in the hospitals, um, everywhere else you should follow and do the you should do the SOPs in all around the Europe, in all around areas we are living. We are a lot of population like in hospitals. Basically, the first of all the wearing a mask. This is very you can say this is the um, this technique I think everyone should follow, to wearing a mask and gloves, and also you should keep a distance almost about 6 feet from each other. And then afterward, the patient with the symptoms of fever, sore throat, and cough, I think you should keep an eye on them. All patient with the fever and cough, you can't say they are the corona patients, but at least you should keep an eye. You can keep an eye on them and observe them, and if later on if they will develop any symptoms related to that, you should go for the screening. And in here, what I can say that here in Pakistan, I think the screening is not enough. In the government sector, they are not enough to say to you can't say that whatever.
Of course, of course. So could you please explain us where this COVID-19 has come from?
COVID-19, the you can say everybody, when it being started, so you can say that most of the people that said it came from the China. So it's a myth that maybe it came from the bat or something like that, from animal. But maybe if you remember back in 2003, there was the one virus that was called SARS. Basically, this is a family. This is a same family. This is influenza. It's influenza virus, and then you can say that it can be a biological. It can be a biological, but the thing is that it has been started. Now we have to follow the preventions, and then we should cure from each other. And the thing is that corona is basically influenza virus, and the it can transfer, or it can transmit from one person to other through like from your respiration, from sneezing, from if you are you should keep a distance from each other, almost at least 6 feet. And it came from, you can't say anything exactly that from where that it originated. Because the place from where it originated, there was a China, from China it began. But now they have a lot of different strains of this virus, not only one strain. Maybe in our country there is a different strain, and in Europe some some different strains. They're like spreading with each other.
Many people still don't know much about COVID-19. Do you have any data on the death rate nationally?
Yeah, I think that I can tell you. I think in Pakistan actually, that all the cases, the critical cases, there was almost 357,000 almost, and out of which in Pakistan, there were the confirmed cases of 357,000, and in Pakistan almost 323,000 people already been recovered, and maybe almost 1400 patients they are critical still, and we read deaths in Pakistan. There were total death was almost 750 in Pakistan nearby. So you can say that in Pakistan it's a much you can say it's a much better, even though we are not following the SOPs in this country. But you can say that our people here, the immune system might be better than the other country. That's why.
Sir, do you have any idea how do normally people catch COVID-19?
Yeah. So for example, we are sitting here, and maybe might be we are not keeping a distance more than 6 feet. So if someone will sneeze through the aerosols while we're touching the surface, and if there is a virus, so while we're touching the surface we can catch with that virus when we're touching the eyes, nose, our mouth. So we can say that we can easily catch that from that. And some so the better thing is prevention and prevention. So you should follow this, wear the warm mask, wear the gloves, and also keep a distance from each other. Social distancing is the more important thing here.
Sir, how effective is wearing a mask in general, as per doctor's point of
Oh,
view?
look, wearing a mask, even like if someone have a typhoid fever, so if you're wearing a mask, I think that will save you from catching the even typhoid fever. So mask is a good practice. Even in the COVID, definitely you should wear a mask. But they are now here in Pakistan. I think there are a lot of I'm not sure, but I've seen there's a much like maybe this one three-ply mask, like it's a surgical mask. I think this will save you. Like, but I have seen a lot of people they're wearing just like cloth or
A fabric,
something
yes,
and
yes.
fabric. Yeah, I'm not sure,
Yeah.
but you can't say there's no safety for that mask. The overall mask is a good thing. I think we should follow. We should keep practicing that.
Right. So you mentioned you recently traveled from Australia, right? So,
Not recently, might be almost 2 years back.
all right, two
Two
years back.
years back, yeah.
Okay, so as per the contemporary situation, are they able to prevent people who are traveling these days, like internationally,
Yeah,
from
exactly. Actually,
COVID-19?
this I have already explained that in during in flights, like in aeroplanes, and the one way of catching this corona, transmitting from one to each other, right? Because in the flight, it spreads through the aerosols. So if one person is infected in the flight, like in the aeroplane, so because the air there's no way for the air to exit in the airplane. So what happens that in aeroplane easily that it can transmit it can infect a lot of people.
All right.
So I think what I say that it is not safe to travel during COVID-19.
Of course, of course. Sir, when somebody gets tested for the coronavirus,
Mhm.
how long does it take for the results to come out?
Almost it takes 24 to 48 hours after you'll get your sample. It will take 24 to 48 hours, the PCR test. I think that one is the only one that you can say is more precise and accurate. Otherwise, there are some like the antibody test, but you can't rely on that.
Of course, of course. So, because everybody's saying different things
Hmm.
about my next question. Because how
Hmm.
long does this COVID-19 situation will last?
Ah, right. Actually, you can't say you can't predict. You can't say that maybe. What I think here in our country, actually, we are not only we are not this country. This is not a welfare country. So here we also fighting with the poverty, like the socio-economic status of here in Pakistan. The most of the people they're not good. So you can't say that if any not even our like 70% population here, they are living below the poverty level. Like the thing is that we can't sit they can't sit at the home, and because they need to survive, so they need to work. So we have to follow the SOPs, and along with we have to take this disease and we have to fight with disease, and we should I think we should keep some social distancing, and we have what I think that you can't predict that how long it will last, because I looked that maybe in Australia, the what I remember that about three months back, I think they didn't have any case confirmed case, but right now the state of Melbourne has already been sealed. Almost most of the suburb has been sealed. So once again, you can say the second wave of corona has been originated over there. So we can't say that we can't predict any specific period or any specific time till it will last. No, we can't say anything. So just we're just waiting for the vaccine. We'll see.
So, talking about the vaccine, how far is the development of the COVID-19 vaccine?
Uh, Look, most of the countries they've already been already working on that. Even Australia is one of them, and Russia, I think they have introduced one vaccine, but still, believe me that we are not sure that till that vaccine it will, because in all vaccines you can't directly directly say that we can use on that human beings now. First of all, that we have to give some trial period on some selected population according to epidemiology, and then we take the statistics, and then we use then we definitely they throw in the market and for the doctor and for everything. But we are hopeful. Might be it will take 3 to 4 months more. I think in America, I think they're working pretty fast on them, and I think they have some kind of vaccine for that. Alright.
Right, right. So, because you are pretty much involved in the community, doctors' community here, what is it that you and other medical professionals need at this point?
Sorry?
What you and other medical professionals need at this point in this COVID-19 situation?
Look, I'm gonna tell you, like the symptoms, signs, and these things. Now, even the 10-year age boy, girl, even they know that. The main thing is there's some policies, and we have to all our my fellows and my colleagues, what they should do, they should at least teach the population and your own staff to then what are the preventions, and what are the how you can cure from this prevention, like you should follow the SOPs in all setups, but unfortunately unfortunately I can't see like in most of our the you can say that most of our like you can say that area the people, they're not following that SOPs and anything, and that's why this disease is getting worse day by day, and that like from maybe now you will see that maybe in future, might be in the past the death ratio was very low, but I'm scared in future it is getting worse and worse, and it is a big threat for our country in future.
Let's hope for the best. Thank you so much for your time,
No
doctor.
worries. Thank you so much.
Thank you.
Thanks a lot. अच्छा इसमें